Well, welcome back. It's nice to see so many people returning. So we're going to continue the session this morning with a presentation from Jasdip Koner. So I'll do a brief, if you'd like to come up to the podium, and I'll a brief introduction to Jasdip. So Jasdip is a registered pharmacist holding a PhD in pharmaceutical sciences and drug delivery from Aston University. He's currently Principal Scientist and Project Operations Manager at Aston Particle Technologies. He is one of the first employers at Aston with an initial focus on developing the use of platform technology and isothermal dry particle coating in dry powder inhalers. So with that, I'll stop and over to you.
Thank you very much. Good morning, everyone. Welcome to my talk today. As Gary alluded to, I'm Jas Koner. I'm the Principal Scientist and Project Operations Manager at Aston Particle Technologies. I also play another role in that I'm a practicing pharmacist, and within this role, I dispense lots of medication to sufferers of asthma and COPD. And as most of us are aware, the gold standard control therapies for these patients are fixed dose combination dry powder inhalers. And over the last 20 years, the industry's employed techniques, manufacturing equipment such as high shear blenders to develop medicines, dry powder inhaler medicines, and we often have to employ formulation strategies to really get the best medicine to the patient. Something the industry strive for is having a technology which we could control and allow us to predict and control the dry powder inhaler formulation to allow us to deliver the best medication possible. And today I'm going to talk to you about APT's isothermal dry particle coating technology and how we can manufacture fixed dose combinations by design. So isothermal dry particle coating, iDPC. It's APT's patented platform formulation coating technology, and it's patented worldwide. And essentially, what the basic operating principle of the technology is that you can coat any small particle onto any large particle, as long as that size difference between the two is 2 to 3 times. The technology itself is very simple. We have a fast rotating chamber, and we inject nitrogen gas within that chamber to facilitate the coating and formulation. It's a very, very low shear technology in that there's no heat generation, there's no use of heat, no solvents, no charge generation, and no particle attrition. It has 3 very simple critical process parameters, which are listed. Sorry, I was supposed to do this, yeah. So, yeah, there we go. It's got 3 very simple critical process parameters, and which are listed here, and they are very controllable and predictable. The process itself is very scalable, and it operates by a principle which we call thin layer fluidization. So within thin layer fluidization, we have 3 key steps. Although they're displayed here sequentially, they actually happen in parallel. But in step 1, we have deagglomeration. So we spin that drum up to high speed, and that generates a high centrifugal force. And what this does is it pulls all the powder to the walls of the vessel, and that powder is held there on the wall. But what it also does is it drives deagglomeration of all our fines into the single particle constituents. In step 2, we inject a nitrogen gas blade. And what this gas blade does, so we have all our powder on the wall of the vessel, it's spinning around. And that gas blade just acts to disrupt that powder layer, but at the same time, it fluidizes small micro pockets. And within these small micro pockets, we disperse that fine material, which is more mobile because of the low mass, and the coarse particles are held more tightly at the wall of the vessel. So those fine particles disperse through our coarse particles, and in step 3, we have absorption of those fines onto the surface of our course. The process can be driven to drive a partial or full coating, depending on what the end requirements are, and depending on the formulation composition, we can have a coating which is a discrete layer, a monolayer, or a multi-layer. So the basic principle of the technology coating fines onto course, it makes it very applicable for the formulation of dry powder inhalers. And over the past 5 years since we were formed, we've done lots of case studies across traditional dose range, so less than 5%. We've also done a lot of work up to 90% API. Because of the unique operating principle of the technology itself, we've seen that we can manufacture high-dose DPIs using micronized material, and we get very unique structures at high dose. But the focus of today's presentation is looking at the manufacture of triple DPI formulations using a quality by design approach. So in terms of the specific study I'll be talking about today, the purpose of it was to use a design of experiments to see if we could successfully and controllably manufacture triple fixed-dose combination DPI formulations. For this piece of work, we looked at 2 model formulations. So we had a base inhaled corticosteroid fluticasone and propionate and a base labours, salmeterol, and athwate, and we then changed the antimuscarinic which we employed in the 2. We had an important design choice was to use lactohel 100 as our carrier, and this was primarily because it's a coarse carrier, but importantly there's no fines, so we didn't want any influence of fines on the resultant formulation. So the design of experiments itself, we used a D-optimal design on a software called Mode, and that design gave us 30 formulations, and we manufactured 2-gram batches, and we had 3 center points. We used the 3 iDPC CPPs, and the 2 critical quality attributes we were interested in were blend homogeneity through RSD and the fine particle fraction from the emitted dose. And all our APSD testing was done using the NGI, a monodose 60 litres per minute and size 3 HPMC capsules, which we loaded with 14 milligrams. So we manufactured all those formulations, analysed them, and one of the first things we saw was actually all the blends were homogeneous. So the content uniformity was below the target 5% RSD. So we didn't then model that data because we'd achieved what we'd wanted across the board. So we plugged in all our FPF data into the software, and we generated valid models, which already gave us an indication that actually the process was controllably manufacturing the formulations, and we were able to sort of predict the performance. But the first piece of data, I guess, I'd like to point you to is the table in the top left-hand side. So what we have here are a range of FPFs that were delivered from each of the APIs within both of those formulations. And as I mentioned earlier, an important design choice was to use a lactose carrier with no fines. So we had no lactose fines and we had no force control agent. So essentially, we were delivering this range of FPFs primarily, well, solely by controlling the process parameters to influence the level of attachment and detachment of that API on the coarse carrier surface. As well, something that we noticed, actually, the performance of FPSX was different between the 2 formulations, so there was an element of interaction between the APIs as well. As we delved a little bit deeper into that DOE analysis, we drawed up some design space. So we have some design spaces here. We have our tiotropium formulation on the right, and we have our glycopronium triple on the left. And we use predetermined FPFs here. But immediately what we saw was lots of green space. So we're generating a large manufacturing control space for these predetermined FPFs. So in essence, we've got to control that process and predictably delivering what we wanted to do. And the advantage here is, if we combine the 2 pieces of data here, is, for example, if we were developing a generic formulation, we could target an FPF range and identify the critical process parameters that would deliver that. Or, for example, if we were working with a new molecule or an innovative formulation, we could identify the process parameters that would deliver the maximal FPF performance. So as we went forward, we put some of the model formulations under an SEM just to visualize the coating that we were achieving. So what we can see straight away here is we have a tiotropium on the left, and a glycopronium on the right. But what we can see is those are individual API particles coated across the lactose surface. So this confirms that the process itself is deagglomerating the API into its single particles and then dispersively and controllably coating the API across that lactose surface. And what this does is, the process can be driven to do is influence where that API lands on the lactose surface as a single particle, and then that influences the level of detachment and subsequent FPF performance. We also see, importantly, that there's no lactose fines in the field of view, so they've all been essentially mopped up by that lactose carrier, and they're controllably and uniformly coated across the surface. So we've got a couple of manufacturability slides now. So something I haven't spoken about is the hardware itself. So currently, and something we've got on our stand today, is we've got a benchtop piece of equipment that manufactures 1 to 20 grams, and we have a pilot scale equipment that can manufacture up to 2 kilos. We've also currently building a 10 kilogram per hour piece of equipment to get to full scale manufacture. But because the process parameters are well controlled, and we're essentially controlling the physics that are occurring inside the vessel, what we've developed is a correlation factor that allows us to do all our work at a small scale and then immediately scale that up to a larger scale and deliver the same performance. So what we can see from the 2 formulations here, which we developed at the 2 gram scale, we could then manufacture larger batches and we were achieving the same performance. And all the work we've done in the past, be that internal or external, we've used that correlation factor and almost immediately scaled up. So it's just telling us that the process is well controlled and we have a well-controlled physics within the vessel. And all this points to very streamlined development programs in terms of time and cost efficiencies as well. So in terms of the stability profiles, the formulations that actually have shown today are actually a stability study assessment at the moment. So I've got some exemplar data from 3 double fixed dose combinations of FPSX. But the message here is actually we're getting the same performance at 12 months from these blends that we get when they were manufactured, when they were first manufactured. And that's all down to the fact that the process is extremely low shear, so primarily we don't generate any charge. And with high shear blends, for example, you do see some charge generation because of the solid-solid mixing process, and that often means that over the first 3 to 6 months you get a drop-off in that FPF performance. But what we're seeing here, because it's all manufactured at low shear, is we get a nice, stable and predictable performance profile across that 12 months. And this all has the benefit of potentially a longer shelf life for the formulations. So as I get to the last slide, a take-home message from the short presentation today would be that isothermal dry particle coating is a controllable process with control physics, and it's able to successfully, predictably and controllably manufacture stable DPIs. I have a couple of acknowledgements. So Innovate UK were the funders of this work, and have also been great funders of our company from the start. We have 3 companies at the bottom who've supported our work as well. The APT team as well, big thank you to them for doing all the work that we've got here, and the organising committee for the opportunity to present today. We are at stand 158, so please feel free to drop by in the short time we have left, or alternatively just drop me an email. So yeah, if you have any questions, please fire away, but thank you for listening.
Thank you, Jasdip. That's really interesting. I think all of us who've been involved in industries trying to make homogeneous blends will probably find this new technology really fascinating in terms of new opportunities.
Thank you.
Do we have any questions on the line or from the floor?
I've got one just while people are thinking. Sometimes with different mixing processes, there can be a need to let things rest and settle before. So you showed some very nice stability data, but do you have any sort of sense of whether you need to let things settle down a little bit before you do your initial assessments? Is that something you see from this new blending technology?
Oh, that's a great question. So no, we have no requirement to rest the blends because essentially the powder is held in a stationary position and we're fluidizing the powder in sort of small micro pockets. We don't get any solid-solid interaction, so there's no triboelectrification or charge. So they're immediately processable as we manufacture. So the data I showed there for stability was straight out of the drum, and on a stability assessment, and then 12 months down the line.
Very good, thank you.
Okay. Thank you. Have you got any more questions? I have one as well. You mentioned at the start of your slides you've made some high-dose formulations of up to 90% API. And, certainly from the talks that we've been hearing this morning, that's maybe something we want to be able to aspire to. But notoriously, high dose and high concentration blends are horrendous in terms of their material properties, in terms of manufacturability and processability. When you've done those, have you actually looked at, the corresponding blends and, in terms of downstream processing? Are you seeing any differences in things like flowability, using the technology that you've used that could make this more amenable to not just producing homogeneous formulations, but also processable formulations?
Yeah, absolutely. So, we've not done any specific filling studies, for example, but what we've done with some of these high-dose formulations is subjected them to some pretty rigorous shaking and seeing if we can make the formulations fall apart. But because they're all coated with, essentially the coatings are held by electrostatic and van der Waals in these sort of end-to-end porous structures, they tend to hold pretty well. So when we did the shaking studies, for example, the content and uniformity remained consistent, even though they were vigorously shaken for 2 hours, for example. But that's down to the way that the process is breaking apart the agglomerates, de-agglomerating the particles into single constituents and then controllably layering them back on.
Great, thank you. Okay, I don't think we can see any more questions.
One came through on Slido. Which new coating excipients can you use?
Coating excipients?
Yes, which new coating excipients can you use?
Well, I guess with the basic principle, we can coat, as long as something's smaller and something's larger, we can pretty much use anything. I think we've explored quite a large range, not only in respiratory, we've done a lot of oral work, and even biological work, and currently we've not found anything which we can't coat. So I don't want to say everything, but thus far we've pretty much used a wide range of excipients, and they've all been, as long as we have that size difference between the fine and the coarse, they can be coated.
Okay, that's great. Thank you, Jasdip.
Thank you very much.